Extraction of diluent from a vial. After checking the diluent, you have to gather your equipment and perform hand hygiene. Check your diluent and verify its expiration date. First step is to clean the rubber top of the vial with alcohol and let it dry for a few seconds. Next is open the syringe package halfway through. Attach the needle to the syringe by twisting it on. Draw an air into the syringe. The volume of air should equal the volume of ordered medication. Remove the cap after. Inject the syringe into the vial and slowly push the air into the vial, then draw the diluent to the desired dose. Withdraw exactly 5 ml of diluent. Make sure to tap the bubbles out by slowly tapping the syringe with your fingers. Then remove the syringe from the vial. Expel the air and check your desired dose. Put the cover back into the vial and now your diluent is ready.
Hello, today I'm going to present to you the reconstitution of a vial. Here in front of me are the materials that we are going to use for this presentation. Now, first up is the medication ordered. Now, the medication that I used is actually just expired dog vaccines that was on its way to disposal, but I just chose to use it for this presentation. Of course, I'm going to dispose of this properly after this presentation. Next, we have our diluent, which is Leptopherm C1. After that, we have our syringe and needle, which I bought already attached to each other, but you can also buy one that is separated. I just found it more easier to handle. And then finally, we have our the things that we use to disinfect our vials, which is just ordinary alcohol and then cotton swabs. Now, usually when you do this presentation, you'd have to get a diluent that is much more larger than my diluent, but this is a single dose. This came in pairs and this is single dose, so I don't exactly have to measure it out and see how much of the diluent that I need in order to get my medication. This is 1 ml. This is a 1 ml diluent, and this is a 1 mg medication, so that's all I need. First things first is I've already washed my hands before recording the video, but I'm just going to sanitize my hand even more with alcohol in order to properly sanitize. Okay. First up, we're going to cotton swab the vials, the tip of the vials, where you will inject the needle. Here, this gray area is where the needle will go inside. Let me just swap that, and then I use the other tip for the other bottle, so we will not cross contaminate. setting that aside, we now have the sanitized vials. Then we are going to open our syringe and needle. Now, in other cases, you would have to attach the needle and the syringe at the same time. In order to use it, but I already bought this like attached like this. This is a 0.5 ml syringe actually, so it's going to be hard, but like, don't worry. So I have to do this twice. Here we have 0.5 of the diluent. And then we're gonna get even more of that diluent, because again, this is 0.5, a 0.5 syringe. I accidentally bought it instead of like a 1 ml. Here we go. As you can see, this is a 0.5 ml, and then the diluent bottle is completely empty. Then plug that in, and then you don't actually have to do a lot of shaking or a lot of anything, because like it naturally just dissolves into the diluent, the medication, but I like to mix mine up just to make sure. And then here we go. The mixture is already completely dissolved. The medicine is completely dissolved in the diluent. And then for the last time, we're going to take that out. Take that out, and here it is, the correct constitution of a vial. Now, I don't exactly advocate for double shots, but so we're doing this in the pretense that this is actually a 1 ml bottle, but so in order, just for demonstration, okay, you need to actually buy a 1 ml syringe in order to administer your shot in one go. As you can see, there are no air bubbles. There are no air bubbles present. If there are air bubbles, what you're gonna do, for example, I'm just gonna get more air. For example, there are air bubbles here. I put like some air, so that it would seem like there are air bubbles. What you're gonna do is you're gonna do this. You're gonna lightly tap it. You're gonna lightly tap the syringe, and then you're gonna slowly and carefully push out the air bubbles on top that landed on top, and bam, you'd have a clear syringe, and then you're safe to administer it. Thank you very much for watching this video, and I hope you have a good day.
there she was. There she was.
Before starting, the right drug, right dosage, expiration date, and instructions must be checked. Carefully take out the bottle from the packaging. You will notice that the same information is imprinted on the bottle. Most drugs include an information sheet, but for this drug, it is imprinted inside the packaging itself. Read the instructions thoroughly. It is recommended to use clean water like distilled, sterile, or bottled water. Always lightly shake the powder in the bottle before adding the water to prevent powder sticking to the bottle. Indicated suggestion on the complete patient's information for this drug is to divide the diluent into 2 portions to make the reconstitution easier. To do this, we will add the first half of the water slowly into the bottle. Since we do not have a measuring device enough for 50 ml, we use a small beaker that can contain half of the specified amount of diluent, and we'll do it 2 times. Close the bottle and shake. The average time length for shaking is 30 seconds to 1 minute. Add the remaining diluent. Recap the bottle and shake again until no powder is left. Shake again if necessary to make sure all the powder is mixed. You can tap the bottle on your hand if there are some powder sticking at the bottom. If there are still some remaining powder after numerous times of shaking, do not worry. The powder will eventually merge into the liquid. Always advise patients to shake the suspension prior to each use. Count the days for when the drug will expire after being reconstituted. You can also write it on the bottle. The antibiotic suspension is now ready for use. Always rinse the measuring device or adding the water since some of the powder might have stuck into the surface.